I think Tricor's future in the near future and in the 4 or 5 years out future is going to be a combination of not only performing the laboratory work, but actually helping with the interpretation of the laboratory work on the post-analytical side, but also facilitating the best use of the laboratory on the front end, what we call the pre-analytical side. So in order to do that, Tricor has to be facile and, if not expert, at least well-versed in informatics and information technology. So it really goes hand in hand that a lot of medicine and a lot of our culture and society is moving in an IT way. So we have to get better at connecting with patients, connecting with doctors, connecting with clinics, so that there's less friction in that flow of information. That's going to be the challenge, but that is our strategy. And with that strategy, then we can not only help doctors take care of this particular patient, but we can help a clinic take care of this population of people that is in their area. Or the state of New Mexico take care of this certain disease entity in the state of New Mexico. So the scope of the work and the informatics involved is really going to be a change for us in the next 5 years.
What do I see in Tricor's future? I think we have lots of opportunities ahead, particularly in the Lab 2.0 space, because we have been identified as leaders in that space, and it's true, we are leading that, we are on the front edge of that movement and of that effort, and that really does start to address what our vision is of being a nationally recognized laboratory leader in population health.
You know, in Tricor's future, I see a solid, stable, growth-oriented organization. And I used the word respect a few minutes ago. Tricor is well respected within the healthcare community, not just in New Mexico, but in the country overall. We are a name that people understand: quality service, great service, and we're trusted.
I like to look at the future through like trifocals. So in the very short term, or very close, we will continue having challenges. We'll have reimbursement challenges on how we get paid for the work that we do, increasing compliance and regulation challenges in testing, in IT. But as you start facing those challenges in the very near future, you think about how you have to change. And so if I'm now looking through the normal distance, or a little bit farther out, having those challenges come at you, you have to rethink things. You have to think differently about how you do work. So I think there will continue being change in Tricor. Like I said, the past 3.5, 4 years, Tricor has changed immensely from what it was. With the institutes in the Lab 1.5 and Lab 2.0. And then if I look in the, in the farthest viewing picture, Tricor is on track to be, to achieve its vision of being a nationally recognized laboratory out there in the community.
I see a lot of things in Tricor's future. There's what everybody's thinking about is PAMA, right? We have to figure out the ways that we're going to work around the PAMA cost cuts. We have to build our alternate revenue sources. That's one of the things that I like about being where I am, because I get detailed into one of those, which is the roads application, but I'm engaged in all of the other components, whether it's the LMS pieces or it's the lab research institute. I think I get to touch and see all of those, and that's pretty cool in this job.